Greetings, friends and followers. This is Nurses Talking. I am Jill Boise. As always, if you like what you see and hear, subscribe. Leave us a comment and let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. Today it's my great pleasure to welcome Alyssa Brandeberry. Alyssa is the owner of an independent legal nurse consulting practice in Pensacola, Florida. And born in Ohio, she attended nursing school at University of Toledo in Toledo, Ohio. After graduation, she worked at a level 1 trauma center as an ICU float nurse and a circulator in the OR. In 2014, she took a travel assignment to Pensacola, Florida, and planted her roots. There she worked as a circulator for the total joint team and assisted with the development of a new plastic surgery division at a local community hospital. In 2016, Alyssa began working at the world-renowned Andrews Institute for Orthopedics and Sports Medicine and helped launch a new outpatient knee replacement program. In 2017, Alyssa moved to Fort Lauderdale, Florida, and she was hired as an in-house legal nurse consultant for a large medical malpractice defense firm. In that role, she evaluated cases from beginning to trial and became invaluable to the firm. When her family moved back to Pensacola in 2020, Alyssa launched her independent practice, My Legal Nurse, LLC, and continues to review cases for law firms throughout the state of Florida. In her spare time, Alyssa is an active volunteer with the American Association of Legal Nurse Consultants and provides mentorship to many aspiring legal nurse consultants across the nation. When she's not working or volunteering, you'll find Alyssa spending time with her family at the beach or training at her local CrossFit gym. So welcome, Alyssa.
Thank you. I'm so excited to be here today.
I'm excited to have you. I really am. So tell me, firstly, why are you a nurse?
Why am I? There are many reasons, I think.
Okay.
Starting out from the very beginning, I grew up with a mother that she still is a nurse. She's still practicing. And originally I really wanted to go to journalism school. And she said, Alyssa, I just want you to be set for life. Which as any mother would, right? I grew up, I would stop at the doctor's office and my mom was the go-to nurse, and we would get calls in the middle of the night from her local patients, with questions, or, she would, if anybody had called her, she was there. And to grow up seeing that, she just set a great example and a great standard for a nurse. And I wanted to be more like my mom, I guess. So I think that's really where I got started. And then, so I really liked science and I really loved helping people. And I think it worked out.
It worked out. Okay. So you had that example. You had, a very good example. Were there any challenges for you though in becoming a nurse?
Oh, absolutely. Nursing school, I didn't really have much help. So financially, so for me, I had to work all through nursing school to support my education. And on top of that, came with challenges with even just passing the NCLEX. It took me 2 times to pass the NCLEX because I was just never good at school. I was always great in the hands-on type of stuff. So that was definitely a challenge, but with lots of studying and determination, I passed, and here we are.
Yeah, I know that NCLEX can be a beast.
Yeah. Then I took the Kaplan study course. Gosh, this was ages ago. I'm sure they still have it, but that made all of the difference.
Okay, good. And so I see in your bio you went into ICU and OR. Are those the only 2 areas you worked?
Actually, so I was a float nurse, and we had a group of us and they knew where we excelled and where we liked to go. So for me, it just happened to be the ICU, but some days I would be on the stroke unit. I would be in dialysis. I was in the ER. They would give us a phone and just say, go walk around the hospital. And if anybody needs an IV, conscious sedation, if a trauma came in, if there was a code blue, you were it. So yeah, that was probably one of my most fun roles, because it was, you never knew what to expect. You were always on your toes, and I got to see that global experience of the patient and understand the inner workings of the hospital, which has definitely led me to excel in the career that I'm in now.
Yeah, I can see that. And you gravitated towards orthopedics though when you moved.
I did, and I'm not really sure how. I think I was chosen before I chose it. You know, you get in a routine with these surgeons, and if you're 2 steps ahead all the time and you're giving them exactly what they need to do the surgery, they want you in their room. So I worked with a great team at Baptist and later on at Andrews, and they became family. So we all just kind of stuck together, and I really did enjoy ortho because I like those surgeries are a little bit more, I don't know how to explain it, but a little bit more gritty as far as, you know, you're moving bones and all of that. So it was fun.
I gotcha. Yeah, at one point I was an OR nurse myself. I gotcha. So, but what would you like to see change though, if anything, about nursing?
You know, but we're in an interesting time right now. I think everyone can pretty much agree that it would be great if there was some sort of reform. I would love to see nurses be put on the front lines of prevention and education. I think that would honestly help the patient population. The patients that we're seeing now are sick people.
Yeah.
So I think, yeah, definitely getting nurses on the front lines, but also if there was a way for the institutions to really pour into their nurses with different resources, as far as like allowing a little bit more time for maternity leave, or really investing in their education and their skills, or allowing them not to have to work over all the time. Because I feel like if you pour into a nurse, the better care she's going to be able to render to her patients.
Absolutely. And you wanted some more time for maternity leave. Many nurses just want time to pee.
Well, and yeah, especially if you're an OR nurse.
You know, I used to say that if I ever were to start an insurance company, I would only insure 2 things. Both of them would have to do with nurses. You'd have to be a nurse, number one, but I would insure your bladder and your feet. And that would be it.
Absolutely.
So you've spread a lot, you know, and done quite a few different things, although they all kind of seem to interlock. What would you say is your greatest achievement so far?
Yeah, I thought about this a little bit, and I don't have one. I think my greatest achievement overall are all the little great achievements where I've made an impact either in somebody's life or I saved their life. You can't put a price on a life, and getting the hugs and seeing these patients walk back into the ICU months later looking great, it was so rewarding. So for that, that's definitely one. I think if I had to pick one outside of the obvious of saving lives, I think it would be the ability to branch out and actually become an entrepreneur and build a business to not only leave a legacy for my daughter, but to have the door open for the opportunity for my mom to continue to well, for me to support her eventually, honestly, but
Mhm.
for her to have that opportunity, just in case, she wants to retire and continue to bring in some income,
Mhm.
it's the safety net for everything. So I was glad that I could have that opportunity, because it's definitely something I never thought I would be doing as a nurse.
Okay, because I was going to ask you about that as well, and what made you become A, a legal nurse, and B, an entrepreneur.
So it was, but I say it's really by divine intervention, because I didn't even know what a legal nurse was when I became one. And what I mean by that is we had some attorney friends of ours that would contact me for medical experts. And I was, what is a medical expert? And they would say, oh, I need a doctor to review these medical records. I was like, oh, I got you. Take out my cell phone. I know this doctor, this doctor, this doctor. So
Mhm.
the joke was one day I'm going to eventually start charging you guys for this. And Brandeberry and Associates Medical Expert Witness Services was born in 2017. And that was my little side hustle. I was still working clinically. I had a brand new daughter. But with that experience, I was able, when we did move to South Florida for my husband's job, and I became a stay-at-home mom. And stay-at-home moms, I commend you. It is the hardest job.
Yeah.
And eventually I just lacked that purpose in my life. So I decided to apply for an in-house law firm position on Indeed, of all places. And I was like, I'm never going to hear from this. I'm not qualified for this. And I interviewed and I got the job, and there I was. So kind of
Yes, indeed.
crazy. It's not the most helpful answer, but we can get to that later.
And actually, I guess it is, because you know what I notice when I speak to nurses is that so many things that we do seem to like almost pick us out. I don't want to say we fall into it, but it almost seems to pick us out and say, this is where you need to be directed.
Absolutely,
Yeah.
absolutely. So,
Yeah. Mhm.
well, we had a second question. Oh, why did I become an entrepreneur? Well, that was also kind of out of divine intervention as well, because of how it happened. Was I had left and came back to Pensacola right before the pandemic, and then the nurse that had replaced me didn't work out for whatever reason. So I ended up taking on both my present law
Yeah.
firm and the one down there, and flipped them both to 1099, and that's how my Legal Nurse LLC was born. And then it has since grown and shrunk and grown and shrunk from there, just with the purpose of, I want to be able to provide excellent service to as many attorneys as possible.
It's amazing how our nursing skills and education just fit you to fit in wherever,
Yeah,
you know?
absolutely.
Yeah.
One builds off of the other, it seems like.
Yeah. So a lot of nursing has changed, though. A lot of things have changed in the last decade and a half. Looking forward, what do you think you see in the next decade?
It's kind of a tough question to answer, in the fact of, I started when we had paper charting, and just to see the evolution of nursing from paper charting into
Yeah.
the EMR has been like, if you would have asked me about that when I first started, I wouldn't have even been able to comprehend it. So I think
Yeah.
looking forward, we're definitely going to see an influence with technology, and I think AI to a point. But I would also like, I think that nurses will be able, hopefully, with any type of reform, like I said earlier, to be able to be better taken care of, and hopefully this influx of technology will help us provide better care to our patients.
Yeah. Yeah, I know. Many people say that technology cannot replace nurses. Well, we can't replace bedside nursing, I guess. But I can see many areas in which AI, for example, can be very useful um, in our profession. And I think we better get used to the idea.
Yeah, it's as much as I want to push it away because I'm getting to the
I
point
know.
now where I don't. When I was younger, I used to pick right up on all of that, and I just it takes me a little bit longer to get through it now. But I do agree that there's no robot that can replace a nurse ever.
No, no.
But we see just after all of this stuff with redundant vault and all these medical errors and
Yeah,
things like that, I think that there will be definitely better systems in place with
yeah,
technology to help
yeah,
avoid patient errors.
yeah. I agree. I agree. I absolutely agree. What would you say to somebody who wants to be a nurse?
If that's something that's been in the back of their mind, I would say absolutely do it. Right now, it's a tough time, with the
Yeah,
pandemic and everything else. It is probably a little bit harder to convince somebody to do it, but
yeah,
I think the most important thing is for them to know that where they start will not be where they land. And
yeah,
nursing provides a niche for all types of people and skill sets.
yeah.
So even if you start in a place where you don't like, the opportunities are really endless.
Yeah, yeah. And that's one of the things I want to showcase because when I started out, I have been a nurse for 49, coming up on 50 years now. And so you know that when I started out, all of these opportunities certainly did not exist. You were a nurse, 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 that's it. And as time has passed, those roles have expanded and expanded and expanded, all sorts of things. There was no such thing as a legal nurse. There was no such thing as, many, many things. And so I really want nurses coming along to see that there is a niche for you. There really is. It doesn't matter what your thing is, what you're leaning towards. There is a niche for you. You can find it. You can pivot. If you don't like where you landed, just pivot. You'll find it.
Mhm.
Yeah. So a couple more questions. Number one of the things we talk about a lot though is burnout and a lack of self-care and all of that, right? I believe that a lot of what contributes to burnout actually is a lack of self-care, among other things. So I'm asking, what does self-care mean to you? Because it means different things to different people.
Absolutely. Coming from somebody that has struggled in the past a significant amount with burnout, especially,
Yeah.
it's one thing to be in the clinical setting and have burnout where you don't have a choice, you have to go back. And then be in a burnout situation when you're an entrepreneur, all the bridges have burned essentially, and your back is up against the wall. So
Yeah.
both carry a lot of weight. Like you said, I believe burnout arises from the lack of self-care. For me, my thought is always, well, how can I avoid getting back
Mhm.
into this situation? And I think the cliche answer is massages, facials, vacations on the beach, and those things are very nice, but it's finding the things that you can integrate into your daily life, and that way you're not relying on those sometimes events,
Yeah.
right? So for
Yeah.
me, it's getting in the gym and into the cold plunge every day,
Mhm.
making sure I'm eating healthy, getting enough sleep, drinking water, and then really being present with my family and being intentional about being present. I think sitting still is definitely a discipline that I'm not very good at.
I
And
understand.
sometimes it looks a lot like the word no.
Yeah.
Sometimes you have to just sit back and I want to do all the things because in Pensacola it's nice outside. We've
Yeah.
got something going on literally every weekend. And sometimes I just have to say, we're just gonna sit at home this weekend and just chill out a little bit. So
Yeah. Hmm. Yeah,
yeah.
I get that. I get that. And all of those things that you mentioned, is actually putting yourself on the calendar, is actually doing something for you every single day. And that's a good thing. Because if you don't do something for you every single day, you get lost. Do you know how many times if you look at your calendar, you actually don't feature anywhere. Everyone else is on the calendar. You've got to run to take somebody to some sports event or pick up somebody or do this or do that. And where were you?
Yes,
Where were
no,
you?
absolutely.
So you got to put yourself on the calendar, however that looks to you.
Yes.
Yeah. So if you had to, though, describe what is the most essential quality of a nurse to you in just one word, what would that word be?
It would be compassion.
Compassion.
I think compassion is essential to being a nurse. It literally in everything that we do. That's, if you go into nursing for the money, you will not last. You have to have that purpose and drive to be there for these patients in the most difficult times of their life. I mean, we are the people holding their hands when they're scared to go to a procedure. We're the last people they see when they go under general anesthesia.
Yeah.
And then, God forbid somebody loses a family member. We're there. We're sometimes that first hug that they get.
Yeah.
So,
yeah.
I think having a lot of compassion drives everything else as far as patient advocacy, the standard of care that you're giving to your patients, as well as your ability to work with others.
Yeah. That's a huge one. And that word comes up quite a bit. And we recognize that we need it, and we recognize that we have it, because you can't function if you don't have it. I don't see how you can. Otherwise you become that stereotypical Nurse Ratched kind of person.
Nobody wants to be Nurse Ratched.
Which most of us are not. Most of us are not. But the thing is also, though, that I think very often we extend a lot of compassion to our patients and our families, and we forget to extend some of it to ourselves and our colleagues. And so I love it when we say compassion, because it helps to remind me and us that, we need to just extend that a little bit further.
Absolutely. And definitely being compassionate toward your colleagues and yourself, and just know that you're gonna get in there and you're gonna make mistakes. We're all human, hopefully not bad ones, but you're not gonna be perfect. So just taking the steps every day to be better, I think.
Yeah, exactly. Just take the steps every day to be better. And don't, exactly, you said you're not going to be perfect. You're not going to be perfect. And so on your first day, when your first patient does not know that it's your first day and you're trying to look as though don't get too discouraged. It's okay. Tomorrow is going to be better.
Absolutely.
Is there any gem you'd like to leave us with before we go?
Honestly, I think the biggest thing, like we had talked about before, if you're thinking about becoming a nurse, there is a place for you. And in your journey, focus on loving the journey, because this is definitely a marathon, not a sprint. And if you do that and you put processes in place in your life to not only take care of yourself, and take care of your family and take care of others, I think that you can't lose. As far as anything else goes, that's all I got for today, unfortunately.
Actually, that was very big. I love what you said, focus on loving the journey. That's huge. That really is huge. So thank you very, very much, Alyssa.
Thank you for having me. This was so great.
I enjoyed this conversation. Thank you.